feeling refreshed a little better after the coffee?
Yes.
Great. Well, the theme of our third and fourth panels is health from a futuristic perspective. And our first speaker on this panel is Deva Beck. Her talk is on fulfilling a 2020 vision for a healthy world, participating globally in Nightingale's Bicentenary and beyond. The year 2020 will mark Florence Nightingale's 200th birthday, had she been alive. And Diva is an author, an educator, and global ambassador for health, women's and nursing issues, international co-director of the Nightingale Initiative for Global Health. She focuses on increasing public awareness by engaging citizens in health advocacy. She's represented the Nightingale Initiative for Global Health at 2 civil society development forums, parallel to UN Economic and Social Councils on Global Health in 2009 and Women's Issues 2010, and mentors a team of UN NGO youth representatives in New York City. And we invite her to be our first speaker on this panel. Please welcome her.
Thank you very much. First, I want to also bring my thank you to the Human Foundation, and to Dr. Rafia and Dr. Maharas. My good friend, Dr. Maharas is my friend from the 1960s. We go way, way, way back. And also for the hospitality of the Alexandria Library. We were remarking, Paula and I, what a remarkable opportunity for all of us to be here in this ancient and sacred and far-reaching place. Thank you so much. My talk is going to be focused specifically on the question, envisioning ways, or how to envision ways to create a healthier future. And I'm going to be highlighting someone who asked that question a very, very long time ago, a woman named Florence Nightingale. And some people will say, well, she was born in 1820. We will be celebrating, as was mentioned, we will be celebrating her 200th anniversary in 4 years. She goes back a long way, and many people will say, well, why do we go back that far to a woman that lived so long ago? Why Nightingale today? Because she was doing something that we still need to find the way to do. As a child, she was raised by her family, and her maternal grandfather, William Smith, was working on the abolition of the slave trade. So she had in her childhood a way to be committed to global issues, even in her time. She was most famously the lady with a lamp, who carried a lamp during the Crimean War, looking after dying British and Turkish soldiers. And that's what she's famous for. She's a famous sanitation advocate, a famous nursing educator, a famous statistician, a famous policy driver. She worked for 40 years after her fame to drive many, many, many of the good issues that arose from the work in the British Empire toward the rights of people. She worked with 5 successive viceroys, posted to Delhi to look after the health and well-being of the Indian people. Gandhi appreciated her after she died in a major paper that he wrote, and accredited her with his choice to become a stretcher bearer during the Boer War. She impacted across the world. She was an advisor across the world. And how did she do this? And why Why do we care about that? The thing that she did that is least known, but for me, most important, she was a consummate communicator for the causes that she cared about. She wrote a book called Notes on Nursing, and the nurses all love it because it's our link to her, our textbook, our original book. But she wrote that book first as a self-help book for women looking after their families at home. Notes on Nursing for people, grandmothers and aunts and cousins and nieces and daughters and granddaughters to look after the health of their families, nursing families. And it was a self-help book, and a very popular book. The first 50,000 copies sold out in 3 weeks. She was a best-selling author. She wrote 14,000 letters that we know of that are in collections around the world. People are still studying and looking at her work. We have 16 volumes of her work in publication now, her collected works. In 2000, when we discovered that we really needed to do something to ask the question about how to create a healthier future, we went back to Nightingale and said, what would have Nightingale done with a fax machine? And now we're saying, what would have Nightingale done with YouTube? What would have Nightingale done with the internet? And that's the question we are asking for 2020. Now, mostly I'm a nurse, and I'm reaching out to nurses. I've been in a conference recently at the Commonwealth Nurses and Midwives Federation in London. And in September, I was privileged to be speaking in Armenia and in Yerevan, and in the former Soviet Union, in Nagorno-Karabakh, reaching out to helping nurses think about their ability to live into Nightingale's commitment, to commit to getting the word about caring, about the things that we care about out to the public. Nurses are very good at talking to each other. And much of what we know, we don't share with anyone else. But if we did, we are a subset of women. And women have an inclination to kind of keep it quiet, and that's our feminine side. When I was listening today to what people were saying about the masculine, men are better at telling the world what they know, right? The doctors know tell the world what they know. One of the things we need to do as women and as nurses is to tell the world what we know, tell the world what we're committed to. And so that's what we're doing with this project, the Nightingale Initiative for Global Health. To discover what nurses know, what women know, the wisdom, caring, commitment that we take for granted. It's what we do every day. How does that get portrayed to the world? Now, we've discovered a couple of these things. We've tried a couple of prototypes that I'd like to share with you. In the year 2010 was the centenary of Nightingale's death. And what we did with that was ask the world to celebrate an International Year of the Nurse. And we asked the United Nations if they would please bless us. And we were told this couldn't happen, but a very interesting thing occurred instead. The people at the top of the Economic and Social Council, the organizers of that August body, said to us, Millennium Development Goal 5 for women, for the health of mothers. If nurses can't bring that forward into the world, who can? It's the nurses who are the ones who are there with women when they're giving birth. And as you may know, MDG 5 was focused on the notion that, well, the reality that still today, nearly 280,000 women, girls still die in childbirth. That's nearly 800 girls women and girls today die in childbirth. And I'm sure you're aware of this in your own places. But this is not news that no one knows this. We have migrants, 50 migrants died drowning, leaving Turkey and coming to Greece, and we all have this news. But we don't know it. As a humanity, this is a story that needs to be told by the people who know the story. So for 2 years, I focused on that just with a part-time webmaster and myself full-time. The story of telling maternal death to the world. Daring, caring, and sharing to save mothers' lives. And with that effort, we had 3.5 million hits from 90,000 unique visitors and 146 nations participating. One small voice with one part-time webmaster. Now, just if you could please imagine with me, 16 million nurses worldwide. 0.0001% of 16 million is 1,600 people. What if 1,600 people did what I did for 2 years to tell their story in Nightingale's name, to envision that the world would know and care about what we know and care about? What difference could that make? So I'm urging you to think about that for the nurses that you know, but also for yourself. What stories can you tell that are important for the world to know? And I'll close with one more example that I recently came across at the Commonwealth Nurses and Midwives Federation in London last week. As it happened, a group of nurses, men and women, from Sierra Leone were there to tell the story of what it was like to fight the Ebola crisis. And to tell the story of how their colleagues died giving care. And to tell the story about the struggle to work against all these incredible odds to fight Ebola. And I found it a very powerful story, and I'm going to be privileged to be collaborating with them to tell their story on our website. But I asked the question, I dared to ask the question, if the nurses in Sierra Leone had had their voice for the things they needed in advance of the Ebola outbreak, would have it occurred? And they said no. No. Think of it. Think what caring, committed voices, people focused on the health of the world, could bring to the world about what they were concerned about. Get the world to care as much as they do. Get the world to care as much as you do. Voices to the world. What would you do with you too? I ask. Thank you. Thank you.
Remember the Margaret Mead quote about a small group of committed people? And I will confess, Florence Nightingale was my heroine when I was 8 years old. I grew up just reading and reading about her. Thank you very much for that. I think that's for Florence.
That's my husband, very privileged to be supported by such a wonderful man.
Our next speaker is Paula Conti, and she will speak on engendering health, a strategic challenge for global health. She's a health sociologist and facilitates education in gender mainstreaming and public policies innovation by collaborating with public bodies, with companies, universities, and research centers, Middle East and Africa, represents the synthesis of practices and methods from traditional medicine, scientific findings, and her commitment in public policies. And Paula, please give her a hand.
Thank you really to invite me here. In my life, so many times I try to imagine the old library, and I can't believe now to be here. So, engendering health, I start from this point to share with you some experience, to reflect together on some points that for me are my way, the way I found it in my life, to traduce gender in practice. Because my job, I needed to find methodologies, ways to traduce public policies or intervention in something very practical for people, for citizens. So I started to present briefly Association Engea, Engendering Health, that is a non-profit association, and we are partner of the European Institute of Women's Health. And we engendering like promotion of health, and also a way to integrate gender in the vision, in the complex vision of health. And then we also designed and launched a web magazine to introduce health professionals to the engendering health complex system. So I think that, on my understanding, what is most important in this moment is to find a way to make the research transdisciplinarity in research, to transform research that is now based on different disciplines in a very new approach, creating competence and knowledge through the filter of gender, I think. So, what is really a challenge is to transform transdisciplinarity from a model to a practice, to be able to use intersectionality, to produce a new kind of knowledge and transfer it, to how to say, we talk about it a lot on these days. So self-reflection and self-awareness is something that have to stay in research. Is not something else from the researcher. And